The measures meant to protect us from the coronavirus aren't always inclusive. Take social distancing, not at all easy and sometimes impossible to adhere to for people with disabilities. Roughly 1 in 6 people have or experience a form of disability. Masks make communication hard for the hearing impaired, like this young man in Uganda who otherwise relies on lip reading.
At Coffee House you just saw is the first sign language only cafe in Uganda's capital, Kampala. Adhere Coffee says it wants to create employment for the deaf community with the ultimate goal of raising awareness for this marginalised group of people, especially during these even tougher times of the pandemic.
Roy Rusa has a customer to serve. Rusa is deaf, so he uses sign language to communicate. He's worked as a barista at this coffee shop in Kampala.
When I make good coffee and I serve a customer's order perfectly and I get a positive feedback, that makes me really happy, especially if it comes from different customers.
Rusa graduated from university 3 years ago, but since then he's had real difficulty finding a job. Uganda has one of the world's highest youth unemployment rates. Rusa says that being deaf makes it even worse.
I would apply for jobs, write letters, send emails, and all that. But whenever I mentioned that I was deaf, they became afraid of working with me. In the end, they wouldn't give a chance. They wouldn't hire me.
All Rusa's workmates are deaf too, but that doesn't stop them from offering great service to their customers. And by employing them, the owner of the cafe wants to help break down stereotypes against the deaf. We want to inspire the other companies and employers out there to employ deaf people because we are capable. I want to use these people here as role models. According to official figures, Uganda has 1.8 million deaf people. That is about 3% of the total population, though activists say that this number could be higher. Rusa says that deaf people are often not taken into account by the government. He cites the recent distribution of free face masks, which he says did not put into their needs into direct consideration.
Elham Yossifian advises the International Disability Alliance and joins us from New York. When it comes to COVID-19, are people with disabilities more vulnerable?
Definitely, yes. First of all, 80% of persons with disabilities all over the world live in poverty. And poverty means they have difficulties accessing the very basic things required to protect themselves against COVID-19. For many of them, social distancing is really not feasible. Like imagine, I am a blind woman myself, and how can I make sure that I am 6 feet away from people in the supermarket if I go shopping? Or how can I get help from people to cross a very busy, inaccessible street in New York? So that's it. Because of that, studies have shown that persons with disabilities are much more vulnerable, especially, for example, persons with Down syndrome are up to 6 times more likely to die because of COVID-19.
Why is that in that case? Why is that?
The reason is that they have already underlying health conditions because of the conditions of the Down syndrome, and because of lack of access to information, because all the information relevant to how to protect yourself against COVID-19 is not really provided in the formats that they can access. It should be in plain language for persons with Down syndrome. It should be in sign language for those who are deaf. Captioning should be available, but none of these are really provided, so they don't learn how to protect themselves. And if catching COVID-19, persons with disabilities are more likely to experience more serious symptoms and lose their lives.
Well, it's like so much in this crisis, things haven't been thought through to the end, have they? How inclusive would you say coronavirus restrictions have been for people with disabilities?
Well, not really. We had cases, for example, in Uganda that a deaf person was shot by the police just because he didn't hear that there was a curfew. We have cases that essential services have been defied without being, considering situation of persons with disabilities that, for example, fixing your wheelchair or your hearing aids is considered an essential service. So these measures have been taken without proper consideration of persons with disabilities. And if you ask me why, I would tell you because they didn't invite persons with disabilities and their representative organizations around the table when they were talking about COVID-19 restrictions. If they had some of us around the table, we would have told them what to do and what not to do to include us.
Sure. What about, though, in the rollout of vaccines? Were those groups invited to the table to advise on making that at least more inclusive?
Well, not in many countries. In some countries, we do have inclusion. And here we are asking for prioritizing persons with disabilities in accessing vaccination because we are in higher risk groups, as I explained. So if the rolling out of the vaccine should happen on the basis of risk, we are experiencing more risk, we should be prioritized. In some countries, persons with disabilities have done successful advocacy, not 100% successful, but at least they have achieved some priority. But in many countries, again, we have been left out from vaccination plans.
What about women with disabilities? How have they been treated during this pandemic?
Well, I don't think that would be difficult to imagine because imagine you're living as a woman with disability in poverty, you're already experiencing a lot of barriers. And when such situation like a pandemic happens, you are the first to be left out. So we had cases that women with disabilities could not access their sexual and reproductive rights, were subject to violence and abuse and couldn't complain, because they were relying on family members to give support. And of course, when you're relying on someone for support without any monitoring, it puts you in a situation of being vulnerable against violence, unfortunately.
You oversee many countries and receive reports from various regions. Any good examples of inclusion during the pandemic?
Yes, there have been good examples. For example, in some countries, they have started broadcasting public briefings about COVID-19 in sign language, which means that deaf persons can also access it. In some countries, social protection schemes have been introduced to provide additional support for persons with disabilities and their family members. And together with our allies, the International Disability and Development Consortium, and we, as the Alliance of Organizations of Persons with Disabilities, have introduced a few campaigns since the pandemic hit, and we have managed to gain some success in making the global fight against COVID-19 more disability inclusive. For example, World Health Organization has started to provide captioning in their public briefings, which means that those who cannot follow the audio can read what is being said. But still, a long way to go.
Good to hear, at least, that there are some inroads being made. Elham Yusefian, she advises the International Disability Alliance. Thank you very much for being on the show today. European Medicines Agency says there's no indication that AstraZeneca's coronavirus vaccine is the cause of reported blood clots. It says the benefits of the vaccine continue to outweigh the risks. The regulator adds that the blood clot events are very rare but need to be evaluated. Several countries have suspended the rollout of the AstraZeneca vaccine following reports that people who received the jab in Denmark and Norway developed blood clots. Let's get you over to our science correspondent now, Derek Williams. He's been looking at the questions you've been sending us on our YouTube channel.
How long can vaccine side effects last? Does discomfort indicate it's working? I want to leave all the speculation about blood clotting and the AstraZeneca vaccine behind for a minute and focus on what we know for certain about common minor side effects reported in connection with COVID vaccines. Pretty much all of the ones approved so far in various parts of the world appear to be pretty reactogenic, which means they regularly cause mild side effects like pain and swelling at the injection site, as well as things like fatigue, headache, fever, chills, or aching joints. The single-shot Johnson & Johnson vaccine appears to cause those effects somewhat less often. In two-dose mRNA vaccines, they seem to occur more commonly after the second dose, while the opposite seems to hold true for the AstraZeneca vaccine. Another point worth mentioning is that younger people seem to react more often and more powerfully than the elderly. It's thought that's because they have more responsive immune systems. Authorities say the symptoms can last a few days, but in most of the first-hand reports that I read, they subsided within 36 hours. The good news is that side effects, while unpleasant, are actually a sign that the vaccine is doing what it's supposed to do, which is laying the groundwork for an immune response so that if you are infected with the virus, your body can get to work straight away wiping it out. Personally, I'm more than happy to experience a day or two of discomfort if I know that I'll be protected afterwards from a potentially life-threatening case of COVID-19. That sounds like a really great deal to me.
I'm with Derek there. Thanks for watching.